Hello, my name is Roberto Larios, and I will be doing a journal club presentation on the efficacy of FLIBANSERIN in women with hypoactive sexual desire disorder result from the BEGONIA trial. This trial was presented by the Journal of Sexual Medicine, Volume 7, Issue 10, July 2013. This was a randomized placebo-controlled trial in which premenopausal women with hypoactive sexual desire disorder, also known as HSDD, were treated with FLIBANSERIN for 24 weeks and a post-treatment of 1 week. The aim of this study was to assess the efficacy and safety of FLIBANSERIN in premenopausal women with HSDD. The outcome was to determine the FLIBANSERIN's clinical effect in the sexual dysfunction as well as the significant safety concerns. Now, the mechanism of action of the treatment of premenopausal women with hypoactive sexual desire disorder is not well known. It is hypothesized that it deals with neurotransmitters such as dopamine, especially serotonin. Pimavanserin exhibits agonist activity at the 5-HT1A receptor and at the antagonist at the activity at the 5-HT2A receptor. This is the first drug marketed in this study group, and there were previous trials such as the Violet and Daisy that were similar to this one. Now, the study design was a multi-center, randomized, double-blind, placebo-controlled trial, which included a 4-week baseline period followed by a 24-week treatment period and a 1-week post-treatment period. The placebo and controls were in total there were women. These women were randomized to receive either FLIBANSERIN 100 milligrams every day at bedtime or the placebo, using interactive voice response system. Now, in total, there were 1,090 patients, which 547 received the placebo and 543 received the actual medication. Now, because of one X or Y reason, some of them had to discontinue the treatment due to adverse effects or personal reasons, and then in total, 446 patients taking the placebo completed the trial, and 408 patients receiving the medication finished the trial. Now, the inclusion criteria for this trial was women aged 18 years or older who had to be premenopausal and diagnosed with generalized acquired HSDD by a clinician. They had to be in a monogamous heterosexual relationship for over 1 year of duration. They had to have a sexually functional partner expected to be physically present for at least 50% of the time every single month during the trial, and be willing to engage in sexual activity at least once monthly. And they had to complete a neat diary at least 80% of the time during the baseline period. Now, the exclusion criteria for this was women with a significant relationship discord, women with any form of sexual dysfunction, psychiatric disorders that could impact sexual function, a score of more than 14 in the Beck Depression Inventory 2, suicide ideation according to a CSSRS, the use of any medication that may affect sexual function, or having any gynecological disorder. Now, the co-primary endpoints for this trial were a change from baseline to week 24 in female sexual function index, also known as FSFI, desired domain score. This was easily assessed by questions such as how often did you feel sexual desire or interest over the past 4 weeks, or how could you raise the level of sexual desire or interest over the past 4 weeks. This was the other endpoint was the number of satisfying sexual events, also known as SSE, standardized in a 28-day period. This was measured using an e-diary used to record sexual events. The secondary endpoints included a change from the baseline to week 24 in the FSDSR, FSFI's total scores, PGI 1 score, and the PBE. The results for this trial were the co-primary endpoints results were that at week 24 there was a change in the FSFI desired domain score from baseline week 1 with FLIBANSERIN versus 0.7 with the placebo. The standardized SSE increased by 2.5 with FLIBANSERIN and 1.5 with the placebo over 24 weeks. The difference between the FLIBANSERIN and the placebo groups were significant at all time points for both the co-primary endpoints, which include the time, this was recorded at weeks 4, 8, 12, 16, 20, and 24. Now, for the secondary endpoints, uh, there were improvements in the sexual desires and the stress associated with the low sexual desire were observed versus the placebo. The FSDSR item 13 score was -1 with flibanserin and -0.7 with the placebo. The FSDSR total score was 9.4 with flibanserin and 6.1 with the placebo. The FSFI total score was 5.3 with flibanserin and 3.5 with the placebo, whereas the PGA-I1 score of 24 weeks was 3.2 with the flibanserin and 3.5 with the placebo. All of these p-values for the primary and secondary endpoints were less than 0.001, making them statistically relevant. Now, in conclusion, the results of this randomized placebo-controlled trial indicate that flibanserin 100 milligrams at bedtime every day has the potential to improve sexual desire and sexual dysfunction and reduce desires related to the loss of sexual desire in premenopausal women with HSDD. This is a baseline. This is a baseline on the co-primary endpoints that show a significant change in the desire and SSE from baseline to week 24. Now, in my opinion, the critique that I gave this trial was that their strength was that it was a very long trial period, which included the baseline period and a post-treatment period. There was specific inclusion and exclusion criteria, and there were co-primary endpoints. Now, some weaknesses that I noticed in this trial were there were many confounding factors that were not addressed. For example, if the spouse was in home often during the trial, if they were in an argument with the spouse, or they didn't find the spouse attractive or not, because these are issues that usually happen. Um, Now, based on the PGI-1 score, only 44.7% were treated, of the patients treated felt their condition improved. Um, Potential biases found in this trial where the main investigator is an employee of Procter and Gamble. Four other authors are employed of Barnard Angen, and then the study was founded was in this study was factually founded by the same company, and that's those are the strengths and weaknesses that I found in this weakness that I found in this trial, and I would like to see further research done to 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 see the efficacy of this medication in postmenopausal women, and then try to see what else we can do, what non-pharmacological